Inflammation is bad for your body. First place that bacteria lodges will be in your heart valve. Periodontal disease and heart disease are linked.
In February, we are observing Heart Disease Awareness Month. For one aspect of heart health, and indeed our overall general well-being that we don't often focus on, is our oral health. And today we're going to share our education on oral hygiene and heart disease.
Well, people are always asking me what's the difference between gingivitis and periodontal disease, and I always tell them gingivitis is when your gums are red and bleeding, but once that infection spreads to the bone underlying the gums, then it causes bone loss in your jaw.
And we know when patients have buildups of plaque in their arteries that we sometimes find oral bacteria in those plaques.
Yes, that was the first indicator through research that periodontal disease and heart disease are linked. And people ask me all the time, how do you know that? Well, we found the bacteria in the plaques in your artery, and that plaque can break off and go to your brain, go to your heart, cause heart attack or stroke. And so they started really studying that and realizing it's not healthy for your teeth nor your overall wellness to have heart disease and gum disease.
And what sort of symptoms should our patients be looking out for in terms of periodontal disease?
Yes, some people can go to the dentist once a year and be fine, but most need cleanings at least 2 or 3 times a year. Shouldn't let your insurance limit you, because we have to know that some people need their teeth cleaned every 3 months, every 4 months. 6 months is okay if your gums are healthy, but if they're not, you really need to have more frequent cleanings.
Sometimes our patients have been told in the past their C-reactive protein is elevated, but providers don't know why. We really need to be asking if they've updated their dental health.
Well, first of all, when you brush and floss, which you should be doing every day and brushing at least twice a day, if your gums bleed, that is the first sign of gum disease. So you know how we're always poking at your gums, we're taking measurements. If those measurements are deeper than say 5 or 6 millimeters and they bleed, then that means that you have bone loss and inflammation in your gums. And inflammation is bad for your body. It can be measured in your C-reactive proteins if you go to the doctor and they do blood work. And I always tell patients, if your C-reactive proteins are high, the doctor should say, hey Amanda, when's the last time you had your teeth cleaned?
And here at Revive, we do our annual physicals once a year, and we always try to remind our patients that they do need to come up and get their dental visits, because heart health is teeth health.
It is. It's totally interrelated. So take it seriously when your hygienist, who is an expert in gum care, recommends certain products or frequent cleanings. Take that to heart, because that bacteria goes to your heart and you don't need that.
For the month of February, this is Amanda Thompson with Revive Primary Care with Dr. Stansbury. Thank you guys for joining us today.
Yeah, we're glad to be here. Thank you.